Hello aspirants, welcome to GDC English classes and welcome to the discussion of MCQs with explanation on Model Paper 2 of Pharmacology regarding Telangana Pharmacist Grade 2. I hope you are already busy with your preparation and definitely reading the theory as well as practicing the MCQs both are important. So for that purpose, so let's have a look on these MCQs and test your knowledge. So how much you are preparing well and how much amount you can remember in your brain. And let's see the first MCQ of this model paper. Amikacin is a, wait a minute. Amikacin is a semi-synthetic derivative of. Amikacin is a semi-synthetic derivative of. So amikacin is generally a aminoglycoside antibiotic. All aminoglycosides are protein synthesis inhibitors. They are taken by the parental route except neomycin primycidine. And aminoglycosides inhibit protein synthesis in the bacteria by binding to 30S ribosomal subunits. So amikacin is a semi-synthetic derivative of options like kanamycin, gentamicin, topramycin, and arbacacin. So amikacin is a semi-synthetic derivative of the answer is kanamycin. Amikacin is a semi-synthetic derivative of kanamycin. Amikacin is a semi-synthetic derivative of kanamycin. The answer is kanamycin. So here the answer is simply amikacin is a semi-synthetic derivative of kanamycin, semi-synthetic derivative of kanamycin, and it is resistant to bacterial aminoglycoside modifying enzymes. So generally, amikacin is resistant to the enzymes produced by the organisms, but kanamycin is having the drawback. Okay, it produces a concentration dependent bactericidal action and also possess post antibiotic effect, and even after drug eliminated from the body also this drug may shows its antibacterial effect with very minute, very low concentration in the plasma also post antibiotic effect, and it is given parentally. Both nephrotoxicity as well as ototoxicity are the drawbacks. It is given parentally and both nephrotoxicity as well as ototoxicity are the drawbacks. So nephrotoxicity, ototoxicity are the major drawbacks of all aminoglycoside compounds. Okay, so going for the next MCQ. So what is the mechanism of action? So what is the mechanism of action of erythromycin? So erythromycin are macrolide antibiotic. The name because of large structures, a large cyclic lactone ring. So what is an erythromycin is also a protein synthesis inhibitor. So aminoglycosides tetracycline binds to 30th ribosomal subunits in bacteria, inhibit protein synthesis in bacteria. When coming to other macrolides, even chloramphenicol, so many number of drugs other than aminoglycoside tetracyclines, remaining most of the antibiotics which are protein synthesis inhibitor, they act by binding to 50S ribosomal subunits. So what is the mechanism of action of erythromycin? Binds to 50S ribosome and inhibit protein synthesis, binds to 30S ribosome and inhibit protein synthesis, inhibits cell wall synthesis, inhibits cell membrane synthesis. So cell wall synthesis inhibited by beta-lactam antibiotics, penicillin, cephalosporins, monobactams, carbapenems, and binds to 30S. Yes, erythromycin is a macrolide, it is a protein synthesis inhibitor, but it binds to the 50S ribosomal subunit and inhibit protein synthesis in the bacteria. So simply the answer is the erythromycin is a class of antibacterial compound under protein synthesis inhibitor. Under protein synthesis inhibitor acts by binding to 50S ribosomal subunit in the bacteria. 50S ribosomal subunit in the bacteria. So the answer is the erythromycin is a class of macrolide acts by binding to 50S ribosomal subunit and inhibit protein synthesis in the bacteria. Next. So this is explanation is very important regarding your competitive orientation. Okay. So here it binds to 50S ribosomal subunit and inhibits bacterial protein synthesis. Yes, that is simple. And here, so 50S ribosomal subunit, erythromycin inhibitor, translocation of this peptide chain, translocation of this peptide chain by binding to 50S ribosome. So erythromycin binds to 50S ribosomal subunit, inhibit the translocation of growing peptide chain from amino acid chain to amino acid side to the P side peptide side and A site not available for binding next amino acid and inhibition of the protein synthesis. Protein synthesis will be stops. So next MCQ. So alpha 1 selective antagonist. So coming to the sympathetic nervous system. The question is related to the sympathetic nervous system. So alpha 1 receptor selective antagonist is so antagonist nothing but the drug nothing but substance oppose the action of endogenous molecule. In the sympathetic nervous system, adrenaline, noradrenaline, dopamine are endogenous neurotransmitter. And here alpha 1 receptors are present on the blood vessels. So when alpha 1 receptors present on the blood vessels, they activated by noradrenaline, increase the blood pressure. So examples like yohimbine, selective alpha 2 receptor antagonist, prazosin, terazosin, and both B and C. So yohimbine, selective alpha 2 receptor antagonist, alpha 2 receptors located in the CNS brain. And prazosin, derazosin, doxazosin, alfazosin, all zosins, commonly they are alpha 1 receptor antagonist, alpha 1 receptor blocker. So definitely the answer will be the D. Definitely the answer will be the D. So answer is the both B and C, prazosin as well as terazosin. So this is a simple explanation. I hope you already having detailed awareness of the classification of alpha blockers. So non-equilibrium type, irreversible and non-competitive. Non-equilibrium, non-competitive. Beta haloalkyl amine, phenoxymetamine, and non-selective, reversible. So alkyl like ergotamine, ergotoxin, and hydrogenated alkyl like dihydroergotamine, dihydroergotoxin, and imidazoline derivatives like phentolamine, toluzoline, non-selective reversible alpha 1 alpha 2 receptor blocker, and miscellaneous like chlorpromazine. Chlorpromazine generally antipsychotic. It can also block the alpha receptors non-selective. And next, selective alpha 1 receptor blockers. Selective alpha 1 receptor blocker. So, selective alpha 1 receptor blockers like aldosin, prazosin, terazosin, doxazosin, alfazosin, tamsulosin, silodosin. So, tamsulosin selectively blocks alpha 1A receptor present on prostate and alpha 2 selective receptor blockers like yohimbine as well as idazoxan. So that is regarding the explanation of the MCQ. So going for the next MCQ. So regarding the next MCQ, so what is this? Chain A plus chain B of insulin consists of insulin. So insulin is one of the important hormone in the body. One of the important hormone in the body. So this insulin produced as a pre-pro-insulin after that converts to pro-insulin. Pro-insulin converts to active insulin. Active insulin contains 54 amino acid in the form of A plus B chain. So the options are like 21 plus 30 amino acid, 20 plus 31 amino acid, 30 plus 21 amino acid, 23 plus 20 amino acid. So option D is wrong, 23 plus 28. So next 21 plus 30, 21 plus 30. So definitely the answer will be the so the answer of this MCQ is 21 plus 30 amino acid. Chain A plus chain B of insulin consists 21 plus 30 amino acid respectively. Totally 51 amino acids. Totally 51 amino acids. Okay. So let's see the explanation of, for more clarity here. So The insulin discovered by Banting and Best. There are 51 amino acids in the insulin molecule. Two chain polypeptide. Chain A containing 21 amino acids. Chain B containing 30 amino acids. So this is the structure of insulin. It contains a two chains, A chain as well as a B chain. A chain containing 21 amino acid, B chain containing 30 amino acid, and total the active insulin endocrine hormone contains 51 amino acid, 51 amino acid. And next, the important thing is insulin containing three disulfide bonds, three disulfide bonds. So the two A and the A and B chain of insulins are connected by disulfide bonds. There are three disulfide bonds are present in the insulin structure. Insulin structure. And you know the importance of insulin. It regulates the blood glucose levels. It regulates the blood glucose levels. So next MCQ. Mechanism of action of theophylline. So I hope you know about theophylline. Theophylline, caffeine, theobromine are regarded as CNS stimulants. So what is the mechanism of action of theophylline? Mast cell stabilizer, phosphodiesterase inhibitor and increase the cyclic AMP, cyclic reduction monophosphate, phosphodiesterase enzyme inhibitor and decrease the cyclic AMP, all of this. So theophylline is not it. So theophylline, caffeine, theobromine are CNS stimulants as well as they causes dilation of bronchial smoke. On the lungs, what they will do increase the phosphodiesterase enzyme, sorry, inhibit the phosphodiesterase enzyme, increase the cyclic AMP levels. Increase the cyclic AMP levels on the lungs causes relaxation of bronchial smooth muscle and helps in the treatment of asthma. So the answer is inhibition of phosphodiesterase enzyme and increase the cyclic AMP levels. So simply the answer is option B. Option B is the answer. So theophylline in treatment of asthma inhibit the phosphodiesterase enzyme, increase the cyclic AMP levels. Increase the cyclic AMP levels helps in the treatment of asthma by relaxation of bronchial smooth muscle. By relaxation of bronchial smooth muscle. So theophylline and aminophylline inhibit the phosphodiesterase enzyme, increase the cyclic AMP, cyclic adenosine monophosphate levels. Cyclic adenosine monophosphate levels. So the increased cyclic AMP causes bronchodilation, dilation of the bronchial smooth muscle, dilation of the bronchial smooth muscle, and inhibit the release of histamine and SRSA from the mast cells, SRSA from the mast cells, and improve the mucociliary clearance in the respiratory passages, increase the clearance of mucoses and free the airways and freely circulates the air. Okay, so this is regarding the explanation of the mechanism of action of theory. Next one, the next MCQ is Cefepime is given by which root? So Cefepime nothing matter comes under the cephalosporins. Cephalosporins are cell wall senses inhibitor in the bacteria and helps in the treatment of bacterial infection. Cefepime, parenteral, oral, sublingual as well as topical. So what is the answer simply? So like these questions are little bit very rare. So Cefepime given by the parenteral route by the injection Cefepime by the parenteral route injection. So here Cefepime, so Cefepime administered parenterally. It can be given either intravenously or intramuscular. I hope so. Into the muscle, intramuscular by the angle of 90 degree. Into the subcutaneous tissue, example insulin, by the angle of 45 degree. Intravenous into the vena with the angle of 45 degree. Intradermal into the dermis with the angle of 10 to 15 degree. The angle of 10 to 15 degree. So what is the next MCQ? So fastest receptor mediated action is through fastest receptor. So there are four types of receptor: ion channel receptor, G-protein couple receptors, enzyme linked receptor, nucleoreceptors. Among all these four receptors, ion channel receptors are acting through the ion channels and they produce action immediately. So cell membrane receptors, intrinsic ion channels, enzyme linked receptors, intracellular receptors. Okay. So intracellular receptors, also known as nuclear receptors, are steroid receptors. Enzyme linked receptors are also known as catalytic receptors. Intrinsic ion channel, cell membrane receptor. So definitely the answer will be the here. The answer is intrinsic ion channel. Ion channel receptors. Ion channel receptors is the answer. Fastest acting because ion channel receptors producing a action potential, producing a skeletal muscle contraction should produce immediately. So for that purpose, there is a requirement of ion channel. So skeletal muscle contraction with help of NM receptors. Nicotine muscle receptors are comes under ion channel receptors. Ion channel receptors. Next. So see the explanation for more clear information. So fastest acting receptors with intrinsic ion channels shows action within milliseconds. So ion channel shows action within milliseconds. Ion channel receptors. And slowest acting receptors are intracellular receptors. Receptors regulating gene expressions, transcription factors, cytoplasmic or nuclear receptors. So nuclear receptors are also known as cytoplasmic receptors, intracellular receptors, as well as steroid receptors. So among Jupiter coupled ion channel receptor, enzyme linked nuclear receptors, nuclear receptors are slowest acting. Ion channel receptors are fastest acting. So let's see the next MCQ. Opioids are obtained from cannabis sativa gives cannabis, papaver somniferum, atropa belladonna gives atropine, datura stramonium gives also atropa alpha. So the simple answer opioids are from the papaver somniferum belongs to the family Papaver. So simply the answer is the Papaver. Answer is the papaver somniferum is the source of opioids. So let's see the discussion. So little bit it having relation to the pharmacognosy also. So cannabis from the cannabis sativa, Cannabidaceae family, opium poppy from the Papaver somniferum, belladonna from the Atropa belladonna, datura from the Datura stramonium. So both Atropa, belladonna, datura stramonium belongs to the family Swardaceae, and both Atropa datura contains an isocytic stomata. An isocytic stomata. Next. So the next MCQ is drug of choice for atropine poisoning. So atropine from the Atropa belladonna. Atropine is a parasympatholytic, shows opposite to the action of acetylcholine. So excess atropine overdose may decrease the muscarinic receptors function. Simply decrease the parasympathomimetic, that is acetylcholine function. So what is the antidote for overdose of atropine poisoning? So atropine blocks the muscarinic receptor and prevents the binding of acetylcholine. Physostigmine, donepezil, neostigmine, tacrine. So tacrine was the first drug used in treatment of Alzheimer's disease. And neostigmine, donepezil, physostigmine. So definitely the answer will be the physostigmine. Answer will be the physostigmine. Physostigmine is an antidote for atropine overdose. Atropine overdose. Sorry. So answer is the physostigmine. So let's see the explanation for more clear information. What is the explanation I gave here? Is an alkaloid from the physostigma venonosum belong to the family Leguminaceae. It is a lipid soluble tertiary amine. Tertiary amines can easily cross blood-brain barrier. And in eye, it causes meiosis, constriction of pupil of eye, helps in the treatment of glaucoma, and is a drug of choice for the atropine overdose. So 5-zostigmine inhibit the acetylcholine esterase enzyme, increase the availability of acetylcholine, and remove the atropine from the receptors, and decrease the overdose atropine effects. Side effects of atropine overdose. Side effects of atropine overdose. Next, the next MCQ is ready for you. So let's check. Benzodiazepine drug used for chronic anxiety state. So which of the following benzodiazepine used for chronic anxiety? Anxiety, worriness, tension. So anxiety is common behavior in the human beings, but if it becomes excess, it may develop anxiety disorders. Anxiety disorder. So options are like fluorodiazepam oxide, first benzodiazepine clinically successful, diazepam having multiple clinical applications, oxazepam as well as alprazolam, all are benzodiazepines. 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 So the answer is fluorodiazepam oxide. Fluorodiazepam oxide is for the chronic anxiety state, severe anxiety state. So let's check the explanation for more clear information. So chronic anxiety state, fluoride pocket is the drug of choice. Short anxiety, oxazepam, lorazepam, alprazolam, diazepam. And generalized anxiety disorder, GAD, generalized anxiety disorder, that is characterized by the chronic excessive worry accompanied by three or more of the following symptoms like restlessness, fatigue, concentration problem, irritability, muscle tensions, and the sleep disturbances. Sleep disturbances. So next, drug of choice for the option seizures. Drug of choice for the option seizures. So the option seizures are because of excess T-type calcium function. Excess T-type calcium function in the CNS, it may develop option seizures, especially increased T-type calcium channel function in the hypothalamus. Options like primidone, phenytoin, carbamazepine, valproic acid. Okay, so the answer is simply valproic acid. The answer is valproic acid. So valproic acid, ethosuximide are the two antiepileptic drugs. Block T-type calcium channel in the brain and decrease the option seizures. The option seizures in the brain because of excess stimulation of T-type calcium channels in hypothalamic neurons. Hypothalamic neurons. The answer is valproic acid. So let's check the explanation for more clarity. So, for example, for treatment of a partial seizure, so partial seizures means only little part of brain will be affected and loss of consciousness is very low. And examples like first line drugs, carbamazepine, lamotrigine, sodium valproic acid, octarbazepine, and also levetiracetam like this number of drugs. So, generalized tonic-clonic seizures, also known as grand mal epilepsy and absent seizures also known as petit mal epilepsy. Sodium valproic acid, ethosuximide. These are the only two drugs can block T-type calcium channels. And myoclonic seizures, sodium valproic acid. Atonic seizures affect the tone of the muscle. Febrile seizures, status epileptica. So there are the different types of epilepsy along with their different types of epilepsy along with their clinical applications. Along with their clinical applications. Next. So what is the next MCQ? So which is not an effect of the atropine. So atropine is a parasympathetic, shows opposite action to acetylcholine. Shows opposite action to the acetylcholine. So regarding here, bronchodilation. Yes, atropine on lungs causes bronchodilation because acetylcholine causes bronchial constriction. Inhibits gastric acid secretion. Yes. Stimulates ciliary muscle. No. Increase AV conduction. No. So stimulates ciliary muscle. So which is not an effect of atropine. So bronchodilation, inhibit the gastric acid secretion, stimulates ciliary muscle, increase AV conduction, atrioventricular conduction. So the answer from this MCQ, stimulate the ciliary muscle. So stimulate the ciliary muscle. Generally, acetylcholine on heart decrease the cardiac muscle contraction. Atropine on heart increases cardiac muscle contraction. Acetylcholine on eye stimulate the ciliary muscle, but atropine on the eye relax the ciliary muscle. So simply the answer is stimulate ciliary muscle is not effect of atropine. Is not effect of the atropine. So let's see the explanation for more clear information. So on the CNS atropine, control tremors, rigidity of the Parkinson syndrome, and on the thyroid gland, decrease the secretion of exocrine glands, and on the heart, decrease the increase the heart function. On the urinary bladder, decrease the formation of urine. On the lungs, relaxation of the bronchial smooth muscle. On the eye, mydriasis, dilation of pupil of eye. On the GIT, decrease the secretions from the GIT. Decrease the secretions from the GIT. So all these atropine actions are opposite of the acetylcholine. Acetylcholine is an endogenous neurotransmitter, parasympathetic nervous system. Parasympathetic nervous system. So let's check the next MCQ. So choose the correct side effect of the selective COX-2 inhibitor. So all COX-2s, rofecoxib, celecoxib, valdecoxib, all COX-2s are selectively inhibit COX-2 enzyme and helps in the treatment of inflammatory related disease. So choose the correct side effect of selective COX-2 inhibitor. Increase the risk of cardiovascular disease, GI irritation, no peptic ulcer, both A and B, as well none of them. Choose the correct side effect of selective COX inhibitor. Increase the risk of cardiovascular, GI irritation and peptic ulcer. GI irritation and no peptic ulcer. Both A and B, none of the above. So the answer is both A and B. Increase the risk of cardiovascular. It can cause irritation on the gastrointestinal tract, but no peptic ulcer. Peptic ulcer is a drawback of COX-1 inhibitors. COX-1 inhibitors like aspirin, etc. So let's see the explanation for clear information. COX-2 is produced at the site of inflammation, hence COX-2 inhibition produces anti-inflammatory action. Drug includes celecoxib, letoricoxib, varicoxib, rofecoxib, lumirocoxib. All coxibs are selectively inhibit the COX-2 enzyme and helps in the treatment of inflammatory related diseases. So selective COX-2 inhibitor all coxibs on GIT, gastric friendly and may cause GI irritation and no peptic ulcer. And this COX-2 inhibitor may toxic to kidney, inhibit COX-2, sodium water retention, chance of edema, leads to hypertension. On heart, high incidence of cardiovascular thrombotic event. They mainly inhibit prostaglandin I2 thromboxane A2 is an unaffected. This may be responsible for the risk of cardiovascular events. Cardiovascular events. Risk of cardiovascular. Risk to heart. Selective COX-2 inhibitors. Next. So let's check the next MCQ. Synthetic derivative of the anticholinergic drug is synthetic derivative of anticholinergic drug is. So what is that synthetic derivative of anticholinergic drug? Omotropin, trihexyphenidyl, ipratropine bromide, atropine. So atropine is natural, ipratropine is semi-synthetic, omotropine semi-synthetic. Definitely trihexyphenidyl. Trihexyphenidyl is the semi-synthetic drug. Semi-synthetic drug. Yes, the answer is semi-synthetic. That is trihexyphenidyl. Sorry, trihexyphenidyl. So next is the explanation for more clear information of this MCQ. So natural alkaloid atropine iosine also known as scopolamine. Semi-synthetic derivatives like atropine methonitrate, homatropine, iosine butyl bromide, protropine bromide, politropine bromide. Synthetic compounds like anti-secretory and antispasmodic. Medriatics direct the people of high vasoselective action in their better anti-Parkinsonian drugs for treatment of Parkinsonism. So this is a simple classification of anticholinergic drugs, which shows action like atropine and opposite action to the acetylcholine. Opposite action to the acetylcholine. So next MCQ. So what is the next MCQ? The information is which is the major process of absorption for more than 90% of drugs. So there are many number of drugs we are taking into our body. Among that, most of the drug, around 90% of drugs undergoes absorption in the body by the process of precipitated diffusion, active transport, endocytosis, passive diffusion. So I hope you know the answer. Passive diffusion is responsible for the absorption of more than 90% of drugs we are taking into the body. The answer is passive diffusion is the answer. Passive diffusion is the answer. So passive diffusion is also known as non-ionic diffusion. So 90% of drugs undergoes absorption by this process only. So 90% of drugs undergoes process this through this only. And the driving for passive diffusion, driving force, what is the initiative force? Concentration gradient, concentration difference, that is electrochemical gradient across the membrane, across the biological membrane. And even passive diffusion follows a fixed first law, FICPS, fixed first law. And next MCQ, what is the next MCQ? Let's see the next MCQ. Which of the following is adverse effect of sulfonamide? So sulfonamides are first clinically successful antibacterial compound, inhibit folic acid synthesis in the bacteria and decrease the further replication of the bacteria. So what are the which of the following is adverse effect? Steven-Johnson syndrome, Kernicterus, crystalloria, all of the above. I hope you know the answer of this MCQ. That is, the answer is all of the above. Steven-Johnson syndrome is characterized by a different type of allergic reactions. Kernicterus, a jaundice in the newborn babies. If pregnant mother took sulfonamides, the newborn baby can get jaundice, Kernicterus, neonatal jaundice. And crystalluria, sulfonamides due to difference in the pH. Sulfonamides may precipitate and form in the urinary tract. So the answer is all of the above. The answer is all of the above. So let's see the side effects, adverse effects of sulfonamides. Side effect is because of along with the drug action. Adverse effects are observed at high dose. So phototoxicity, light sensitive, Steven-Johnson syndrome, crystalluria. Sulfonamide solubility decrease in acidic urine and precipitate the drug thereby causing crystalluria. And Kernicterus in newborn due to displacement of bilirubin from plasma protein binding site increase the levels of bile pigments in the plasma and may reach blood-brain barrier in neonates and cause jaundice, neonatal jaundice. Neonatal jaundice. Next MCQ. Next MCQ. Blockade of both type 2 dopamine and serotonin 2A or 2C receptor is a distinctive feature of. So blockade of both type 2 dopamine as well as serotonin type 2A or 2C receptor is a feature of pimozide, haloperidol, catanserin, clozapine, catanserin as well as the clozapine, catanserin, haloperidol, pimozide. So generally, clozapine is comes under the category of second generation, also known as atypical antipsychotics. So second generation antipsychotics can block dopamine receptors as well as serotonin receptors. But first generation antipsychotics only blocks dopamine receptors. The answer is here clozapine. Clozapine is a second generation or atypical antipsychotic. Can block both serotonin as well as dopamine receptors. Clozapine. Clozapine having the drawback of agranoside, but its derivative olanzapine does not have that drawback. So this is regarding what are the examples of agonist, antagonist on the serotonin receptors. Next, next MCQ is tranexamic acid is used when there is a overdose of tranexamic acid is used when there is overdose of fibrinolytics, organophosphates, barbiturates, oral anticoagulant. So epsilon, EACA, epsilon amino caproic acid, epsilon amino caproic acid, epsilon aminocaproic acid, tranexamic acid, both are antidote for overdose of fibrinolytics. So, fibrinolytics are the drugs break down the fibrin and decrease the clot formation. And excess dose of these drugs may lead to bleeding. To control that bleeding, these drugs epsilon aminocaproic acid, tranexamic acid as an antidote for overdose of fibrinolytics. Overdose of fibrinolytics. The answer is fibrinolytics. So tranexamic acid is an antidote for overdose of fibrinolytics. So let's see the explanation. So tranexamic acid, like epsilon aminocaproic acid, binds to lysine binding site on plasminogen and prevent its combination with fibrin, leading to fibrinolysis. It is 7 times more potent than the epsilon aminocaproic acid. Preferred for prevention or control of excess bleeding due to fibrinolytic higher dose, fibrinolytic overdose, excess dose. Next, next MCQ. Choose the correct route of administration of insulin. So, insulin is not taken the oral route, subcutaneous, intravenous, oral, as well as topical. I hope you know the answer already. Insulin is generally taken by the subcutaneous route of administration. Subcutaneous route of administration. The answer is subcutaneous route. Through subcutaneous route, insulin is taken to the body for the treatment of diabetes. For the treatment of diabetes. So let's check the explanation. So insulin discovered by Banting and Westing. So it contains 15 amino acids with 2 chains, 21 in A chain, 30 in B chain, and insulin preparation is administered through the subcutaneous route in the abdomen, buttock region, anterior tire, dorsal arm. So by the subcutaneous route into the particular body parts. So which of the following is an endogenous peptide present in the body? Endogenous nothing but in the body. So which of the following is an endogenous peptide? So endorphin, dynorphin, enkephalin, all of these. So enkephalin, dynorphin, endorphin, all these endogenous peptides present in the body, they shows action similar to the morphine and decrease the pain. For example, now I am taking the class on standing position. If I continuously taking the class on standing position, I will get tired, fatigue, I will get pain. But after some rest, I will get relaxed because of some morphine-like substance present in the body. They cause pain relief, like endorphin, dynorphin, and coupling. All of these are endogenous opioid peptides. Decrease the pain sensation in the body, causes relaxation to the body by producing pleasure, a state of well-being. So the answer is all of the above. Answer is all of the above. The explanation is, so let's see the explanation of this last MCQ. So endorphin binds to the mu receptors and dynorphin binds to the K receptors. Enkephalin binds to the delta receptors. So there are three types of opioid receptor mu, K, delta. All these opioid receptors are belong to the G protein couple receptors. Especially these opioid receptors activates this opioid receptors activates G alpha IR naught that leads to decreased cyclic AMP and decrease the pain sensation, and these drugs produce analgesia, loss of pain. These drugs produces analgesia, nothing but a loss of pain. Okay, so this is regarding the session on model paper 2, especially for the Telangana Pharmacist Grade 2 students. Okay, thank you. Subscribe to GDC English classes.